Hi, and thanks for joining us today at Doctor On Demand headquarters in San Francisco. I'm Tong, Chief Medical Officer at Doctor On Demand, and I'm here today to try to answer some questions about flu and to see if we can dispel any myths about it. As you all probably know, the CDC has done something that it hasn't done for the 13 years that it has been tracking flu surveillance throughout the country. We actually are under a national epidemic that has been cited as really one of the worst flu seasons that the country has seen since 2009. And I'm happy to talk a little bit about that. If you have questions, please do send those in. And we'll do our best to answer those. And and if we aren't able to, maybe we can follow up and get you answers and do any research if it's needed. But there's some very basic things I think that people often wonder about the flu, and one of the questions I've already gotten from a number of patients is, why is the flu so bad this year? And so I want to just talk about that for a couple of seconds. So what the flu does and the way that it evolves over time is as the virus replicates, the DNA of the flu virus itself and the different subtypes of it actually change. And when they just change a little bit, it's actually something called genetic drift, where your body still recognizes the flu as what it is. So if you've already had that flu before, your body very easily recognizes it. But what happens when there's a genetic shift or a bigger change in the flu, where the flu virus has changed, so all those little changes over years add up to a very big change, where the body all of a sudden, our immune system no longer recognizes the flu. When that happens, you actually get these sort of windfall flu epidemics. And actually, that's actually what happened in 2009 when the H3N2 viral strain of the flu was detected. And so that was actually a shift, not just a drift. And so what we saw there was that our immune systems hadn't seen that flu before. And so patients got a lot sicker. They actually had more hospitalizations and a higher reliance on emergency room visits because people were just getting extremely sick. We actually even saw a number of deaths. So this year is a very similar year to that. It's not clear whether we've seen that large shift and whether this is an entirely new strain. But what we can say is that the strain this year, the predominant strain, is the same as the 2009 strain, which was H3N2. And so we are expecting that we're going to see mortality, so patients actually dying from the flu, and then also requiring hospitalization. And again, there are some patients who are going to the ER, although we want to discourage that as much as possible, unless you're obviously severely ill. So those are just some basics about the flu and why it has been really severe this year. So again, 2009 was the last time we saw something like this. This year is actually probably even worse, or is on pace to be a worse flu season than 2009. And they're really the same strain that caused the same two really bad flu seasons. So this H3N2 strain is one that even if your system is recognizing it, it's different enough that it's actually causing pretty severe illness. The next question I think that came in was, is it too late to get the flu shot? So absolutely not. It actually is not too late to get the flu shot. A lot of people don't realize that you can actually get the flu. Because there are different subtypes of the flu, you can actually get the flu more than once in one flu season. You could get one type of flu, and then after you've had that, your body will be pretty good at recognizing it. But you can get a second or a different type, subtype of flu, and if you have that, then you actually might have a whole other new episode of flu, sickness, and illness. For those of you who wonder, how do I know, Dr. Tong, if I'm actually having the flu or if it's just a common cold? The common cold earns its name. It's a very common thing that you can have, and much more common probably than the flu. And normally it's far less severe. So we don't really have to worry as much about the cold. But in a flu season like this one, where we know it's more severe, everyone should be on the lookout for flu and really ask themselves the questions: do I need to be seen by a doctor immediately? And what I'd say about that is if you begin to have fever, if you feel a really abrupt onset of illness coupled with fevers, headaches, chills, and muscle aches, and then also just a feeling of what we call malaise or fatigue, so you just feel really tired and drained out. Those are all very common symptoms of the flu, whereas a typical cold you might report sore throats and sniffling and runny nose. Those types of symptoms are a little bit more common in a cold. With the flu, your fever is going to be very high, so a temperature of 100 to 104. But if you have a temperature, would be a fever. But if you have a temperature that is over 102, that's when I'm starting to get really concerned. And then at 103, it's almost indicative that you've got the flu, because a common cold typically will not cause you to have a fever that's that high. So those are some basics about the flu. I think the other question I was trying to make the point of getting the vaccine is that you can have the flu twice, and some people have said, well, I've gotten the flu shot before and I felt like I was sick. So this is really one of the myths I think that we should address about flu is you actually can't. So the vaccine is not active. It's not a live vaccine when you get a flu shot. So you actually can't really get the flu from it. But you can get a reaction to the shot, though. And I think some people equate that to when they feel a little bit more tired or they feel a little warm. What I can say there is that is not a flu. That is actually just your body having a reaction. It could be your immune system actually ramping up. So I wouldn't equate that to the flu. And so if it is a viral illness, or if you do get the flu right after a flu shot, that's probably because you were exposed to someone with the flu. The flu was already incubating in your body, and you just got unlucky with the timing. You had the shot, and then you actually felt the symptoms from the flu. So, but the flu shot itself is very unlikely to give you the flu. Some of you may have read that this year's flu vaccine is not as effective, and it's really hard to know for each when you're in the middle of a flu season whether the flu shot is actually going to be effective or not. But this is something that we've been doing for many years now. The World Health Organization and the CDC, every year they do their best to test and predict which strains of flu are going to be the active strains. And so every flu shot now normally has 2 or 3, and this year even 4 different types of flu that are being covered. And so that includes H3N2, so the active flu this year is being covered. And so I recommend that people get the flu shot. There's in this same flu that we're seeing now, we believe it was seen in Australia early in the year in their winter, and so they had about 10% effectiveness of the flu shot. But last year we also saw the H3N2 virus, and that flu we had about 30, almost 40% vaccine effectiveness. So what that means is, 40% of people who got the shot last year, it was the flu vaccine actually was active in helping them, preventing them from getting the flu or having as bad an episode of flu if they did catch it. So those are some things about the flu shot. Looks like a question came in, and so it looks like it's as good as the. It looks like the question is oxalocoxanum as good for flu as Sambucol? So I think you're asking specifically about over-the-counter treatment. The most active medication that we have, and the most effective medication, in fact, the only one that's been shown to be clinically effective and an evidence-based treatment for flu is really Tamiflu. So other medications or other remedies really are seen more, are often more over-the-counter medications and symptom relief, and they can be effective for that. But if I had one thing to recommend that you do if you were to contract the flu, or you believe that you've been exposed and you have flu symptoms beginning, is really within the first 48 hours is that you contact a doctor. It's one of the most important things that you could do because, especially given how severe this flu is, the reasons for that are a doctor can help you figure out whether or not you have the flu. They can diagnose you with that, and it's a clinical diagnosis. And once they've made the diagnosis, they can initiate the treatment. And Tamiflu is a treatment that you have to start. Ideally, it's most effective if you start it within the first 48 hours. It is true that the medication Tamiflu may have some benefit if you take it outside of that first 48 hours, if you begin to take it outside of the 48 hours. So if you started at 72 hours, it may still have some benefit, but it won't be as effective. But in patients who are extremely ill, so patients who get hospitalized, the Tamiflu is we would, I think we would give it whether someone's within 48 hours or even presents outside of 48 hours. We would still give that medication because it's really the most effective thing. So even if you're in an ICU, they would give you Tamiflu. We have the benefit of being able to give you that same medication, though, within 48 hours if you get to a doctor right away. So one of the most important things that you could do is just seek medical attention quickly. There are, one thing I didn't mention, there are populations that are at higher risk for flu and hospitalization resulting from the flu, and those are people who have some kind of weaker immune system. So things that can leave you with a weaker immune system would be patients who have diabetes, patients who are on prednisone or steroid medication, patients who have asthma or cancer or are pregnant. All of those are groups of patients who really want to pay close attention and really need to seek medical attention without question. You just need to do that so that your doctor can adjust your treatment regimen accordingly and really help you fight off the flu. Looks like we had another question come in. How fast are the onset of symptoms? So the symptoms actually come on super quickly with the flu. So someone will feel very well, and then the next morning they may wake up, or in the middle of the day they may realize that they all of a sudden have to go home from work and they just don't feel like they can complete the day. The symptoms come on very abruptly. So I mean, really, you could go from hourly within feeling really fine in one part of the day, and within 2 hours you could really be feeling pretty badly. So so that's how quickly those symptoms come on. Can you take Tamiflu if pregnant? I believe you can take Tamiflu if you're pregnant, but again, you should, if you're going to take it, you're going to consult your physician. And so if there's any reason, because all pregnancies are not the same, so if there's any reason or risk for you during your pregnancy, you should actually ask your doctor and give them the specifics of your pregnancy. I'm pregnant and worried, runny nose, achy neck, and back. Should I get seen? So absolutely. So that goes along with the last question. I mean, if you're pregnant, again, as I said, you're at higher risk. One thing I will say is the good news is for your unborn child is that your immunity and your exposure to the flu actually is carried on or passed on to your unborn child. So for the first 6 months of your child's life, they are actually protected. It's almost like, so if you had gotten a flu shot, they actually would be protected by your getting the flu shot. Your unborn child would be protected for about 6 months, which is really nice. So, but after 6 months, you do want to think about getting them a flu shot during flu season. Tamiflu for kids, so absolutely, Tamiflu is available for children. So the question was, can I give this to my children? Absolutely. You need to see a doctor, and then they'll be able to help you with a diagnosis. One thing I would say is we don't want doctors to jump to the conclusion that everything that they see in cold and flu season is the flu. So don't be surprised if you're doing a telemedicine visit and the doctor asks you to look down your throat or to feel your lymph nodes, or if they want you to feel over your sinuses. They're doing that because they want to help you they want to make an accurate diagnosis, and they want to make sure that they're not missing a bacterial infection. Bacterial infections we would treat totally differently. We would treat those with antibiotics. Tamiflu is not an antibiotic, so that's an important thing to point out. And as I said, just don't be surprised if your doctor wants to do a more thorough exam. Also, the other thing is, don't be surprised if the doctor asks you for your temperature or asks you to get your temperature. So if you have a thermometer in your home and you are feeling sick and you want to be seen, it's very helpful for you to get your temperature, and actually to do it more than once. Just do it a few times leading up to the visit so that you can get an idea, the doctor can get an idea of what's called the fever curve, or following the course of your illness. One more question here. Let's see, different types of flu shots, and 3 strands, and it looks like it says mine, and more. Yeah. So there actually are multiple different ways that you can try to ward off the flu or prevent the flu with vaccine. This year, however, the recommendations are they're all by flu shot. Unfortunately, I don't like shots any more than anybody else, but so I had to get mine. But it is important to do. And the flu shots that are available this year, most of them are going to be trivalent, or carrying 3 different strains of the virus. But there are some, and you can ask if you want to, there are some strains that are out that have, there are some flu shots that have 4 different strains of the virus. So So you have to look for those. There's probably not as much of that or as much availability of that 4 strain. But if you want that, you can ask your doctor, and you can really look for places that are actually providing that vaccine. And I might recommend that this year just because the flu is so bad. Let me make sure that there were other myths. One more myth I think I could cover is whether you can spread the flu if you feel well, or can you have the flu and feel well? And the answer is you can, actually. So you may have the flu, and you might have been exposed 3 or 5 days before you actually develop your own symptoms. So you could feel completely well, be exposed to other people, and actually be passing that flu virus to them before you actually ever feel sick. That's one of the hard things about detecting and treating the flu. But as soon as you do feel symptoms, right, there's not much you can do about it if you don't feel anything, but as soon as you do feel something, I think it's really behooves you and the people around you, especially your family members and your coworkers, if you see a doctor. If you know that you've been exposed to someone with a documented case of flu, really good idea to think to end in your household. And especially if you are in a group that I named where you're pregnant, diabetic, if you have cancer, if you have kidney problems or liver problems or asthma, all of those groups of patients should really think about taking the Tamiflu before they actually even develop the flu. So it's actually prophylactic treatment of the flu in members of a household that have been exposed to a documented case of flu. It's effective. It's a different prescription than just a typical straightforward treatment with Tamiflu. But I would definitely recommend that you consider doing that if you're in one of those, as I said, high-risk patient populations. Let's see. And are these false negative tests, meaning you test negative, but do have flu? Great question. Actually, a lot of people, I even wrote that down for myself because I knew that question was going to come up, but I forgot to look at it. Yeah, so there is a flu test, and a lot of people have been tested with. It's usually what's called a rapid influenza detection test, or RIDT. That's the typical test that you might have in an office. The problem with that test is that it's not 100% specific or sensitive. So what that means is you could have the flu and test negative. So even when you look at the CDC and look at their recommendations, you will see where most doctors may choose to just make a clinical diagnosis, and what that means is they're not going to rely on a test, and we don't rely on a test to make this diagnosis. And the reason for that is the result of the test is not going to change my treatment. During a high flu season like this, where we have a national epidemic of the flu, and we know that it's a very severe flu, we as physicians are trained to be able to make that diagnosis clinically and really have the authority to override any test results. So even if the test is negative, I might, it's just such a high likelihood that you have the flu, I'm going to treat you anyway. So we really don't need a test to diagnose the flu, especially in a season like this one. The most important thing is that we get you treatment, get it recognized, get it diagnosed, and then get you treatment quickly. And really just quickly, the last question was just about false negatives. So a false negative, that's a pretty experienced question, probably, or experienced person asking that question, maybe even a healthcare professional. A false negative means the test was false. So it says you don't have the flu, but it's incorrect. So you actually do have it. So that's what we term a false negative, just in case people aren't familiar with that terminology. Okay, what percentage of flu shots are effective? I got it 1 month ago. So first of all, awesome, good job. I'm glad you got the flu shot. Right now we don't know. What I can tell you is that flu season was earlier in Australia, and what they reported was about a 10% vaccine effectiveness. And so that we don't know if we're going to have the same level of effectiveness, but that would be pretty low effectiveness based on our past track record here in the United States. So the hope is that we learn, and that information and the specific strains that they saw in Australia, that information is fed forward, and if there's enough time, and the United States and CDC predictive model, with their predictive model, if they're predicting the same strains that were seen in Australia, and we think it's going to be the same flu, then I would expect that we're going to have better numbers. So hopefully you're going to have a 30 to 40% likelihood of being covered by the vaccine. The next question would be, what did you say it was called to get a pre-treatment if I'm pregnant and have been exposed. Oh, okay, so that was Tamiflu. So it's actually the same medication. There's only one medication. So if you are pregnant and you're preterm and you've been exposed, then you can actually use a Tamiflu prescription. It's just important that you alert the doctor that you're taking that as prophylaxis and that you don't actually have the flu, because it's slightly different. It's a slightly different regimen. So I think there's another question coming, so I'll go ahead and wait for that. I'm being aided here by some very skilled people who are fast writers. Is the flu as bad as I'm hearing in the news? I have a special needs child and I'm asthmatic. So absolutely, the flu is very severe this year. Higher rates of hospitalizations, higher rates of mortality, and children actually below the age of 5 seem to be at maybe increased risk of mortality from the flu. Now, I want to just state that mortality or death is very low likelihood from the flu, but it does happen, and so that when it does happen, it normally is reported in the news. And so because of that, I would recommend, if you have a child who's asthmatic or you're asthmatic, that you consult your physician or do a video visit and find out if you should be treated, especially if you have any symptoms. The other thing that I'd say is I hope that you've gotten the vaccine already. If you have asthma, then I would actually get the vaccine, or if you're pregnant, I would go ahead and get a flu vaccine to protect yourself and your family. My family keeps passing a cold around. What do I do to stop it? So that's a tough one. If it's a common cold, there may not be much you can do, but the best things you can do to prevent yourself from getting sick, I know it sounds funny, but even wearing a mask might be protective. Making sure that you wash your hands as much as possible. If you don't always have access to water and a sink, then I recommend you get one of the little Purell hand sanitizers, or any other brand. I'm not brand specific, but get a hand sanitizer that you can carry around with you. We have them located all over our office, and if you're feeling generous, maybe getting some for your office as well. Bring them in so that you can keep your hands washed. That just helps you. If you touch anything that someone has been sick has touched, it helps prevent you from actually touching something and giving yourself the flu. So there was a bottom part to that question. If you have the flu, can you still get the shot? Yeah, if you're currently sick with the flu, you actually you probably will be declined. They probably would not want to give you the flu shot at that time. In a way, if you actually have the flu, you're at least against that specific flu strain, you're essentially getting inoculated there, and your immune system is doing what the flu shot would have done. But after you're well, and if you still want to get the flu shot, I would recommend doing it, because this is after you've recovered. I would recommend that you do get the shot, though, because it does, as I said, have about 3, maybe even 4 different strains in it. So it'd be really valuable for you to get the flu, because then you're going to prevent yourself from possibly getting, from being really unlucky and getting a second flu bout. Yeah, so there are people wondering if they have access to our services, it looks like, and I just want to say to everyone that we are in all 50 states, so you can actually reach a physician within minutes, face-to-face on a video visit. The most recent state that we actually launched in was the state of Arkansas. Arkansas has probably some of the most progressive telemedicine laws in the country at this point. So it was really great to have them really take a step forward and really push telemedicine forward by saying that they really want to require a video visit be done. I think that's really great, really bold move. And if you're in one of those states, Arkansas, Texas, Florida, any of the 50 states will be able to treat you. And the last question is, if you're allergic to Tamiflu, what other treatment is available? So really good question. And I'm not aware of actual reactions or allergic reactions to Tamiflu. So I think the best thing to do would be to talk to a physician and find out, you need to really report what actual symptoms you may have had. There's not an equivalent to Tamiflu, so that's the most effective evidence-based treatment. However, there are other medications. They're called amantadines, and the amantadines who actually do, they're not recommended, but they are another treatment. They actually work through a different mechanism than Tamiflu, but that's actually something that you may want to take, and your doctor might think is useful for you if you do have a true allergy to So I think we have time just for a couple more questions. And so the question was actually asking about a different medical problem altogether. Do we treat or do we detect high blood pressure? And the answer is yes, we do. Actually, Dr. On Demand does have a chronic disease management program, and we actually do manage patients who have high blood pressure, high cholesterol. And you may know that we launched labs recently, and so we have the ability to test you for thyroid disorders, for a number. We can test your kidney function, your liver function. We can do a number of screening tests. So those are additional components that we can absolutely address. And so all of our physicians are board certified and able to manage a wide array of primary care conditions. And so the question is, how do you tell through the video if it's viral or needs an antibiotic? Great question. This is where I was talking about the clinical criteria. It's actually really hard to tell the difference between a viral and a bacterial infection, whether you're in a video visit or whether you're in the office. So all of our guidelines, treatment guidelines, and all of our physicians are trained on those guidelines, and they follow clinical criteria that allow the physician to increase the likelihood that you have an infection. So if you think about each question a doctor asks or each thing that doctor does on exam, each one of those items, each question and each exam finding is like running its own little test. And each test, or the result of each test, so your answer or what I observe on exam, provides me with a higher or lower probability that you have a bacterial illness or a viral illness. But this is basically what we do at Doctor On Demand all day, all year round, is we try to help patients figure out whether their condition is viral or bacterial. And so we're pretty well, I would just say we have a very good experience and expertise at this point, making that determination with a video visit. But it includes the history, it includes an exam, and then it includes evidence-based guidelines with criteria that we can actually make those diagnoses. How many more do you guys want to take? Maybe we'll take a couple more. Okay, so we'll take 3 more questions. This is great. I love that we're getting so much activity here. Thank you all for your questions. And just a reminder, if you came in late, my name is Ian Tong. I'm the Chief Medical Officer for Doctor On Demand, and we're in the Doctor On Demand headquarters in San Francisco. Okay, so how fast does septicemia progress? Will you get a fever first? Boy, that's a great question. Typically, yes, you will have fever first. Our body has these early warning systems, and fever could be one. Also, a slightly faster heart rate could be one, and a stronger or more vigorous beating of your heart, which means a larger pulse, which might be hard to measure for you. But the way that I would measure that on a video visit is I would have you put your fingers on your pulse, likely your carotid pulse, and if I see that your fingers are moving like this, right? So your pulse is bounding. It's beating. Your heart's beating so hard to keep your blood pressure up. It's actually moving your finger. Then there are clues like that, as I said, that our doctors are trained to look for, so that we can actually make those diagnoses early. But septicemia is, and I should define it, is when a bacterial infection moves from an area of your body into your bloodstream. And when that happens, you actually have to be on IV antibiotics. So you actually have to be given antibiotics directly into your bloodstream to remove that infection. That's a very serious illness. And so fever could be an early warning sign for sure of that. But I want to make this point. You could also be very cold. So you could have actually hypothermia or a very low temperature as well. And so you can see, and your skin might feel extremely cool and cold. And so if you have that, that's the other thing to look for. So it's not always a fever, but if you're very cold or you have an abnormally low temperature, that's another indication for maybe getting an evaluation for a bacterial infection in the blood. Someone said that they used Doctor On Demand while they were traveling to another state, and they want to know, can they do that, right? If I use Doctor On Demand, can I use it again if I travel? And the answer is yes, because that we are really like 50 different medical practices in 50 different states. You can actually use Doctor On Demand in any of those states. So what we will do is we actually built in this really neat technology where we geolocate you. So we know where you are. We basically know your zip code, where you're standing, and we match you to a doctor who's licensed in that state. So you may not always be able to see the same doctor. You absolutely can see the same doctor if that doctor is licensed in both states. But we will match you to, again, a board-certified physician who's licensed in the state where you're standing. So you don't have to worry about traveling farther away from your primary care doctor. That's fine. You don't have to worry about calling them and whether or not they can prescribe across state lines. You can use Doctor On Demand, and we'll have a state licensed doctor ready for you. So So this is the last few questions. So somebody is working in homes and they notice that there's a lot of germs, and they want to know if the mask and gloves are sufficient to protect themselves. And I would actually say that that's about the best that you can do. Wearing a mask and gloves is absolutely a good idea. And then just making sure that you are not rubbing your eyes with the gloves if possible. And even if you take off the gloves, making sure you don't rub your eyes there, because again, your hands can, if they touch an area where the virus is, you could actually transport that to your eye if you rub them. Some people even wear goggles if they're using a lot of chemicals, just as another protective measure. That would be fine as well. So absolutely recommend that. That's a good precautionary measure to take. And then what immunity boosters do you recommend? So actually, there's been some data on this. I think we did a blog on this not too long ago that did talk about what can you do to prevent. Obviously, there's some just old-fashioned things of making sure you have a good diet, that you get enough rest. Those are really important things. But to boost your immune system, a daily vitamin C. So actually taking vitamin C daily can be pretty effective at prevention or shortening duration of symptoms with cold and flu. It's not a cure, and it's not something that you can just take a lot of vitamin C all at once after you get sick, but really using it as a prevention measure. So taking a daily vitamin C could be helpful. And then after you get sick, zinc preparations have been shown to be effective. Those are small studies that have looked at zinc and vitamin C, but they have been effective. And one thing I'll just warn you about zinc is you do not want to take the nasal zinc preparations, because they actually run the risk of causing you to lose your sense of smell. So that's been reported. I believe most of those products have been removed from the market. But if you happen to have one laying around in your house, I would say it's time to throw it out. Don't use the nasal preparations of zinc. So last thing, I just want to say thank you all for calling in. Some people may wonder what happens after I see the doctor. Can my doctor see that information? Absolutely. So we actually have our own electronic medical record that we built. And so that's stored, and you have access to that in your mobile device or on your computer. So you can request the records, share them with we can send them to your doctor. So if you give us that information, we can certainly do that with your permission. Also, it's worth pointing out that if you have insurance, Doctor on Demand does take a number of large national and smaller regional plans of insurance. So ask your health plan, or just go to the app and you can actually put in your plan information, and we'll be able to actually do a real-time lookup and see if that you're eligible. And then also, finally, there's a lot of large employers out there. Doctor on Demand is the telemedicine provider for a lot of large employers nationwide. And so, so hopefully your employer has informed you that you actually have access to this benefit, and you can actually see a doctor from the comfort of your own home. But if you're wondering and you're not sure, absolutely please do ask your employer. And if enough of you ask, we can probably make it easier for you to get access to us. I really want to thank you guys for joining us today. I hope this was informative. Sorry that I was just, lots of run-on sentences and a lot of information here, but judging by the number of questions, I think people were understanding and following the conversation. I want everybody to stay well and have a healthy season. But if you do get sick, you know that we'll be here to help you out. Thanks very much.